The ankle sprain, an all too familiar injury for most people. In this video I thought I'd talk a bit about what an ankle sprain is, how the rehab looks, and link it to some high profile sports cases. So the case we'll discuss in this video is the PSG forward Neymar, who sprained his ankle back in November and is still sidelined from his injury. So what is an ankle sprain? Simply put, an ankle sprain is a stretching and tearing of the ligaments in the ankle. It is a relatively common injury and has a high prevalence in the sporting community. The most common form of ankle sprain is when the foot rolls inwards, or when the toes are pointed downwards and the foot rolls inwards. This is what we call a lateral ankle sprain and occurs from an inversion type injury. The most common ligament injured in this injury is the ATFL, which is the anterior talofibular ligament, which runs from the outside of the ankle and attaches in the foot. It has a high prevalence of reoccurrence in the sporting community, with some literature reporting up to 70% of people will re-injure this ligament after injury. There are multiple risk factors for ankle sprains, with the most common risk factor being a previous ankle sprain. Other factors that can be involved are things like footwear and the type of sport that are involved. So ankle injuries are very, very common in sports like football, rugby and netball, which involve a lot of twisting, a lot of turning, and have external forces like sliding tackles in football. So if we link this back to the case study of the PSG forward Neymar, back in November he was involved in a slide tackle, and as he jumped to get out of the way he landed on the other player's foot. As he landed, his foot has rolled inwards. Now this is getting on for 6 to 7 weeks since his injury now, and he is still sidelined with this injury. If you have a quick Google or look on his social media, you can see some of his rehab and you can see the video of the injury. So he's had quite a severe ankle sprain when we compare it to our sort of mild ones that we see when people are out and about walking or trip over the curb. So why is Neymar still out injured? Well, let's talk a little bit about soft tissue healing. And the best way to visualise soft tissue healing is thinking about any kind of cut that we've had before. So muscle injuries, ligament injuries are similar in the way that they heal to skin injuries and cuts. So try and visualise things a little bit like that. So immediately after injury, we enter the bleeding and inflammatory phase. So when we're in this phase, this is when we see swelling, redness, heat or bruising occur at the injury site. So after we've injured ourselves, we get this big influx of blood and cells that are involved in fighting infection and breaking down any kind of dead tissues. So this is why we see that sort of classic presentation of an ankle sprain where it starts to bruise and it gets really, really swollen within the first sort of few hours of injury. So the bleeding phase starts immediately after injury and lasts up to a few hours. It then progresses and overlaps with the inflammatory phase of healing, which is where we get this influx of cells to the area to help break down any tissue and fight infection. This phase of injury healing lasts from 1 to 3 days roughly, and then we overlap a little bit with the proliferation phase of healing. The next phase on our injury healing cycle is the proliferation phase. So the proliferation phase starts within 2 to 3 days of the injury and can last from 2 to 3 weeks during the injury healing cycle. So during this phase is when you start to see things almost join back together again. So think of it as putting up the scaffolding around a building. So the building blocks start to be laid down in the healing process. We start to see new blood vessels form, which bring fresh blood to the area and fresh nutrients to help with the healing. So if we relate this again to kind of our skin injuries, this is when we start to see the wound close and that scab form. So it's not the original tissue that was there, but it starts to join back together again and look a little bit more natural versus the first 2 days where it's kind of yellowy and still oozy. So a similar process happens in our muscles and in our ligament healing. So we go through that inflammatory phase into the proliferation phase, which is when things join back together again. Now this is when people often feel that the ankle has got a bit stiff, but you'll also see that the swelling starts to reduce down. So this is the phase where physiotherapy really kicks in and where we start to do a lot of mobility work with it and trying to get you to put some weight on the ankle and start to do some muscle contraction to get things working again in the ankle or whatever joint we're talking about. So as we've said, in this phase of injury healing, this sort of 1 to 3 weeks post-injury, this is the vital time when we need to be doing our physiotherapy and doing our treatment management. So the new research around ankle sprains has started to show that we need to start rehab immediately, and that there's a high risk of re-injury rate if we don't start rehab within the first few days. So as we said, if you look on Neymars' social media, you can see pictures of him wearing a boot on his ankle. So in this phase of his rehab, he probably is struggling with a lot of pain and a lot of swelling. So to allow him to keep his fitness up, they'll have put him in a boot so he can get on the bike in the gym. He'll probably be doing some swimming and some underwater walking or water treadmill training, which will allow him to try and maintain his football-related fitness. Obviously, in this time as well, anyone, and particularly professional athletes, need to maintain their general fitness. So he'll be doing, any core work, upper body work. He can do exercise on the other limbs, so he can use the weights machines. It's just trying to allow that ankle to heal whilst maintaining all of the other muscular function, your strength and your power in all your other joints and other tissues. So yeah, have a look on his social media and you can see some of the kind of exercise and stuff he's been doing in his early phases of rehab, so within that first sort of 3 to 4 weeks. So our next phase of injury healing is the functional phase. So this is where we start to see people do their more sport-specific tasks. So if you're a footballer, this is where you're going to start getting back into your football drills. If you're a rugby player, this is when you're going to start to do some pitch side stuff. So maybe some light bag work for tackling. And if you're a boxer as well, this is when you start to get back into some bag work as well. Again, in this phase, this has got a big crossover with the last 2 phases, and you need to be mediated by your pain in this phase. So this is kind of the phase where we're seeing Neymar right now with his training. So this phase starts from sort of 3 weeks to 3 months into their training. Obviously in this stage we don't want to be in any boots or any casts when we're progressing our rehab. So yeah, at this stage you're going to start to see pitch side training, you're going to start to see running, you're going to start to see some power and strength training, and this is really the stage where you want to see people get their strength back, get their mobility back, get their power back to allow them to return to play. Then their final stage of rehab is going to be your sport-specific rehab now. So this is where you need to have your full power, you need to have the full strength in that ankle or the knee or whatever we're rehabbing. So this is the stage where you're going to see people doing their sprinting drills, but you're going to combine it with twisting, turning, tackling, volleying a football, and this is the stage that we need to get through to return to play. So after the proliferation phase or subacute phase of healing, we then enter the remodelling phase of healing. And again, in comparison to the other 2 phases, there is a big crossover with the time frame when this happens. So this is generally a sort of 3 to 6 week mark, but again it can cross over with the previous phase. So it can start from one week to 6 weeks. Now in this phase of healing, this is when we start to see the remodelling of the tissue that's involved. So we start to see the realignment of the muscle fibres, the tendon fibres, the skin tissue, whichever tissue we're talking about being involved. This is when we start to see our muscle power and our strength start to return as that tissue starts to heal and become a bit more mature and a bit more normal. So this is when we have our sort of collagen-rich tissue start to come to the area. So in this phase of rehab, this is when you'll start to see people return to the gym, maybe return to a little bit of pitch side training, so maybe some light jogging, some weight training, all whilst maintaining the mobility and the flexibility within this stage. So this is where we start to see what people would normally see as normal rehab and active physiotherapy, rather than the quite early stages where we are trying to allow that swelling management and that pain management to resolve. So after we're in the remodelling phase, we then again have a bit of a crossover with what we call the functional phase. Now this is where we start to see a bit more sport specific and a bit more task specific training come into. So if you're a person who doesn't do any sport, this is the phase that some people may independently stop their rehab. So they've got the mobility back, they can walk on it, they're happy, and that's where they leave things. They may still get pain when doing things like the stairs or driving, but often we see a bit of a dropout of rehab here. So our final phase of soft tissue healing is going to be the return to sport or the return to competition phase. So in this phase of recovery, this is when we want to see the return of full range of motion, full power, full strength, full flexibility. We want to see our players improving their coordination, their proprioception, and looking at getting them back to their chosen sport. So in this phase, this is when you're going to see the footballers start to do their sprinting drills with twisting, turning, tackling, kicking the footballs, being ready for those events that occur in a match. The other important part of this phase is going to be the psychology of sport as well. So, you know, that rugby player who's returning to full contact tackling, you want them to be confident going into tackling. You don't want sort of a 75% effort where they are going to put themselves at injury risk again. And the same goes for football. So as we've already said, the video of Neymar's ankle injury is pretty nasty. You know, that's going to knock any player's confidence, and you want that player to be confident going back into it. You know, they run the risk of re-injury by jumping out of tackles or moving out of the way, and they're obviously not at their optimum for their sport, so they're not going to get chosen for the squad selection. So this is the real sort of high-end rehab phase now, where players integrate fully back into their training, and this of course is the harder phase of rehab. You know, it's much more active. You'll still see some of the more passive treatments happening, you know, the sort of flexibility, mobility and physio, maybe some hands-on stuff just for a bit of muscle recovery. But this is where we need to see our players really pushing themselves and returning to sport. So overall, as we've said, with the soft tissue healing, there is a huge crossover in phases, and we can see return to sport from 2 to 3 weeks up to 5 to 6 months, and even longer in some cases. So all the stages are not set in stone. You know, our players have to hit their milestones when they progress through their phases. So there's a huge variation in our return to sport, which again is why we see why Neymar has been out for so long with his ankle injury. He's obviously sustained quite a nasty ankle injury, and he's, you know, a high level athlete. You know, he is the best of the best, so he has got a huge task to get back to return to play. So I hope this video has been helpful and explained a little bit about what soft tissue healing is, and what lateral ankle sprains are. You know, please contact us for any treatment advice and for any injury advice, and we can progress you back to your return to play. Thank you very much.